Hello, my name is Lauren Charter. I am a postgraduate student at the University of St. Andrews and the lead author of the research titled "The Word That Comes to Mind is a Polymath: Medical Students' Perceptions of Rural Postgraduate Careers." My team of researchers included Dr. Anita Laidlaw, Senior Lecturer in the School of Medicine, and Dr. Robert Scully, Lead Generalist Clinical Mentor of the Scott Gem program. Lack of access to healthcare services challenges the delivery and accessibility of healthcare to rural and remote communities in Scotland, where 29% of the population resides. Recruiting doctors with the necessary skills to practice in rural areas is becoming ever more challenging. Rural recruitment can be targeted in medical education. Curricula which addresses rural health issues helps foster interest in working rurally. There is some evidence to confirm that curricula encourages rurally oriented medical students. One possibility we looked to explore was whether curricula could alter existing perceptions of rural practice. Here at the University of St. Andrews, we have two medical programs. The first is the BSc program, which is a typical integrated systems-based honors degree, with graduates transferring to a partner school to complete their primary medical qualifications. The Scottish Graduate Entry Medicine Program, or Scott Gem, is the first graduate program in Scotland commissioned specifically to address rural generalist healthcare shortages in Scotland. It runs in partnership with the universities of Dundee and the Highlands and Islands, as well as NHS Scotland. Students are offered high-quality mentorship and role modeling, as well as a 40-week immersive longitudinal integrative clerkship, which is typically offered in rural locations. We use this contrast between the two medical programs to explore rural practice perceptions held by medical students. This pilot study examines the University of St. Andrews' medical students' perceptions about rural and remote practice and how these perceptions influence their interest to practice rurally in the future. To do this, we conducted 10 in-depth semi-structured interviews of medical students. 4 of the students were from the BSc program and 6 were from the Scott Gem program. Of these students, 2 of the BSc students intended to practice rurally, while 5 of the Scott Gem students wanted to practice rurally. Unique to our research was a deductive application of a theoretical framework. We used Feldman and Ing's Careers, Mobility, Embeddedness, and Success framework, which assesses factors that motivate and encourage workers to change careers and occupations. Previously, this framework had only been used to evaluate the mobility and embeddedness of current professionals, so its application to students was unique to our research. We found that students perceived the geographical isolation of rural and remote Scotland as a major inconvenience for their patients to access specialized or secondary care. This would be especially concerning for doctors in areas with older patients and limited public transport. Participants perceived limited resource provisions, including technology, in rural healthcare, which deterred some of them from wanting to practice rurally. Our findings included a unanimous perception across all participants that rural settings have fewer staff compared to urban locations, leaving rural physicians without additional support to check their work. Urban-style secondary care specialists were identified by students as impractical members of the rural health workforce. Participants perceived the urgent need for more rural generalist clinicians, and many were excited about the role's versatility. Scott Gem participants had a unique educational experience as they had significant exposure to rural medicine education through lectures, small group teaching with a dedicated clinical generalist, and rural clinical placements. Student perceptions confirmed that this generalist education provided practical training and knowledge and a realistic view of rural practice. This made them aware that rural generalists could specialize in an area of interest. The uncertainty of not knowing what will come through the door next and learning a wider array of skills as a generalist was favorably perceived by some participants. This adaptation to handle uncertainty, specific to our Scott Gem participants, was perceived as a learned behavior established during GP placements. Relating to their personal life, some participants perceived that rural communities constantly observe their physicians' everyday life. The feeling of being watched all the time in rural communities was expressed by participants. Our findings can inform improvements in some key curricular areas of medical education. First, medical education can challenge the common perception of rural isolation through experience mechanisms that emphasize the use of virtual technologies for a variety of uses. Secondly, role modeling with generalists and rural clinicians should be encouraged and added to medical curriculum. Thirdly, medical curricula should actively address uncertainty to ensure students are not dissuaded by its prominence in rural practice. even more important given the significant uncertainty associated with practice during the COVID-19 pandemic. Finally, previous research has provided good evidence that co-designed, immersive medical education opportunities result in medical students who are increasingly motivated to undertake rural practice. More of these programs should be encouraged and funded by medical programs, communities, and governments. We believe this pilot study can be used to inform a larger study that examines the mechanisms identified to potentially influence medical students' perceptions of rural and remote practice. We believe approaching these challenges in a systematic and theory-informed way will allow medical programs, policymakers, and governments to fully consider the impact medical education programs have on rural and remote healthcare recruitment and retention.